we are going to talk about dementia risk reduction perspective for the Middle East and North African area. As we know, dementia is a global mental health problem, and the number of people expected or estimated to have dementia of different types has been increasing through over the world. Around 40% of cases of dementia can be prevented, and this is a demonstration looking at 30 or 12 different ways of considering or taking action to reduce risk of dementia. We're going to talk about these risk reduction factors and with special emphasis on their impact on the Middle East. Now, starting from number one, physical activity. Physical activity is a very important component for a good health, cardiac health in particular, but also studies show that cardiac health is also related and linked to brain health. Because of that, there is emphasis on increased physical activity for all ages. Smoking is linked to lung cancer and cardiovascular diseases, but also studies show that it is also a risk factor for developing dementia. This is why smoking campaign and smoking cessation clinics, which has been developed in some of the Arab countries, are a promising strategy to encourage young people to stop smoking and hence reducing one element for the factor that can cause dementia. Drug and alcohol is a growing growing problem as well, although we don't have clear number of people who are consuming alcohol. Some Arab countries have less restricted amount of use of alcohol in public. It's considered a shame and stigma, so this might discourage some people of using alcohol, but also probably having policies to reduce alcohol intake will help in reducing the size of the problem and hence reducing the risk factor for developing dementia. Air pollution is another considered problem in some of the MENA areas, so especially areas that are related to fog or unclean or unhealthy airs can lead to risk of developing dementia. Social contact is an issue. Some studies show that people are living in small areas. Some elderly people or some middle-aged people live alone with limited social contact, especially during the COVID area because of the restriction to social distancing. Some people got to the habit of living on their own. So strategies to encourage social contact, people to socialize, meet and greet would encourage people to reduce their risk of developing dementia. Level of education, one of the oldest factors that had been studied. We know about the classical NAN study that looked at level of education as a risk factor for developing dementia. So it's quite promising to see that some Arab countries are investing in education, adult education and older adult education. So having education access to everybody for free or for a kind of affordable amount would reduce the risk of dementia. Obesity is a major risk factor, especially in the Gulf area. There are studies showing that because of the sedentary lifestyle, temptation for people to consume lots of unhealthy food, limited physical activity because of sometimes the hot weather, which is quite prominent in some of the Gulf area, might limit people to exercise or increase the risk of developing obesity. So obesity is a risk factor for cardiovascular diseases as well as for developing dementia. So developing program that encourages people to consider healthy eating, increase level of exercise, probably prescribe exercise for some people who have morbid obesity. So if they can't afford going to the gym, that can be supported by the country or the government. Hypertension and diabetes, one of the most common chronic conditions that are prevalent in the Middle East in particular. Some studies show the higher prevalence of diabetes, probably related to consanguinity in some of the countries, as well as the unhealthy lifestyle, consumption of large amount of unhealthy food, level of carbohydrate, in both, so early detection and strict management following international guidelines for both diabetes and hypertension is likely to reduce the risk of dementia. This is a summary of the different factors that contribute to dementia, and we focus on the Middle East.